first week of pregnancy. The pregnant symptoms, development, and tips to a healthy pregnancy. For most women, especially for those who aren't planning a pregnancy, week 1 goes by without them realizing they are pregnant. Even until week 2, they may go undetected. Lots of women's monthly cycles are variable, so most women assume that when their monthly menstrual cycle is late, it is just that late. There are no instant or obvious pregnancy symptoms, especially during the first week, but there are some signs such as fatigue, loss of interest in things, mood swings, constant needs to urinate. However, most women think these are the symptoms to PMS instead of assuming they are pregnant. Commonly, your menstrual cycle will last for about 28 days, even though it could be from 24 days to 35 days long as well. Basically, the process starts when an egg leaves the ovary and moves into the fallopian tubes to encounter with the sperm to fertilize. When the fertilized egg moves through fallopian tubes into the uterus, this is where implantation occurs. Woman was speculated as wasn't really pregnant during the first week of pregnancy. The reason is because the fertilization will only place at second week. This is one of the reasons that causes so many pregnancies goes undetected, especially when they are curious testing in the first week. A negative indicating not pregnant result is less reliable. If you still think you are pregnant after a negative result, wait a few 2 days and try again. A positive test shows you are pregnant result is almost certainly correct. Changes in your body at first week pregnant. During the first week, there are no noticeable physical changes going on, but there are many internal changes actually happening. The common signs of pregnancy are such as gas, constipation, tender breasts, fatigue, mood swings, morning sickness, hormonal changes. These signs can differ from women to women, so most women don't feel these changes until after the second week. Doctor advised that the first week of pregnancy is very important, that what you do can impact your pregnancy, so ensure to be extra careful with your diet. Your baby's development. During the first week of pregnancy, you will see no huge development of the baby other than the egg leaving ovary and moves to the fallopian tubes. Actually, you are not really pregnant at this time, because conceiving for baby will not happen only until about 2 weeks after your period had stopped. Yet this week was recorded into pregnancy calendar to assist doctor to calculate first day of your last monthly menstrual cycle day. This day was related to the 9-month cycle, or also known as 40 weeks in medical terms, had found your expected due date. As soon as the egg was fertilized, the cells started to split over the next 7 to 10 days. The first week of the baby was called a blastocyte. This blastocyte can break down into 2 parts, where the external part of this blastocyte will become the placenta, while the internal part will become the embryo during the second week of pregnancy. Multiple zygotes may form if there are more than one egg gets released and fertilized. 46 chromosomes was found in zygotes that are an equal number from each parent, and the chromosomes contain genetic material in them which can conclude the baby's sex, hair color, features, skin color, height, and eye color. Pregnancy week 1 tips. For those who are planning to get pregnant, everyone will find that the first week will be one of the joy and anticipation. If you are watching over your morning basal body temperature, notice that your temperature will remain higher beyond day 16 of your luteal phase or post-ovulation. You may find that this is the first physiological sign that you're pregnant. Finally, you should take this time to consult your obstetrician to set an appointment and change your eating and physical habits if you've not yet done so. If you are taking medication and have not yet consulted with your doctor, now is the time to ask your doctor in questions whether it is okay to continue use your medications while your pregnancy, or do you need to quit your medication completely. You must begin to take the important nutrients of vitamins and minerals such as folic acid, which usually recommended by your pregnancy doctor as soon or even before you are conceiving for baby. They can also be found in natural foods which you can naturally include into your pregnancy diet from today onward. Check up with your pregnancy doctor for the reason to know for more about these important nutrients like the vitamins, minerals and folic acid.